If you are currently prescribed a GLP-1 medication or are considering one to treat your obesity or other metabolic health condition, but your insurance does not cover GLP-1 medications, then you definitely want to listen to this video. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I very regularly prescribe GLP-1 medications to my patients with obesity, overweight, and metabolic health conditions. And some of my patients are fortunate enough to have insurance coverage and others do not. And for my patients who do not, I very often utilize LillyDirect's program. And this video is going to talk about this program in detail. One of the very frustrating things about the US healthcare system in regards to treating obesity and a lot of our metabolic health conditions is that we have wonderful medications available to treat these conditions, particularly our GLP-1s, but insurance is not required to cover these medications. So many patients qualify medically for these treatments, but their insurance does not cover them. Or maybe they cover them, but there's a very, very high copay. And this can be very confusing and, like I said, frustrating for both patients and providers. Fortunately, there's a lot of advocacy going on that is improving access. Particularly one win that we've had recently is the Medicare GLP-1 Bridge program, which I talked about in a recent video and will link here. But for anybody who does not have Medicare, is uninsured or has commercial insurance but is interested in utilizing a GLP-1 but doesn't have that insurance coverage, I highly recommend considering LillyDirect. Now, LillyDirect is a direct-to-consumer program. So this is Eli Lilly, the manufacturer of Zepbound and Foundayo and many other medications. They created the medication, designed it, studied it, and they manufacture it. This program cuts out that pharmacy middleman, and with a prescription from a patient's provider, you will get the medication directly from Lilly, the manufacturer. And so the way that this works is that you will see your medical provider just like any other visit, but instead of them sending the prescription to your local pharmacy, they will send it to LillyDirect. Once LillyDirect gets that prescription, they'll process it, then they will reach out to you, the patient, via text from an organization called Gift Health. They will confirm that they received the prescription, they will confirm your delivery address, and then they will accept your payment for the medication. So you'll be able to review the prescription, delivery address, make that payment to Gift Health, and then Lilly will send you the medication. And the medication can go to your home directly, or it can go to, I believe it's Walgreens as the pharmacy that they have partnered with. So whatever you feel most comfortable with, whether that's, delivering it to your home or your local Walgreens, you can make that choice when you purchase the medication. Now, what medications are available through LillyDirect? There are a few, but I strongly recommend Zepbound quick pens. And here is a sample of the Zepbound quick pen. I recently did a full video about how to use these quick pens, especially when you're prescribed a higher dose and are taking a lower dose to make the pen and the prescription last longer to save you money. So I'll link that here, and I highly recommend you check that out. I'm not going to go into the details of this video, but I recommend the quick pen because they're easier to use. They're more environmentally friendly because it's just one pen, versus for Zepbound through LillyDirect, they have single-use vials. So if you chose the vials or you prefer those for whatever reason, for your preference, you get single-dose vials with a syringe and needle to use for each dose. So it's just a little bit more complicated to dose yourself using that method because you pull the medication from the vial into the syringe and then dose yourself that way. So there's more steps, more room for air, more opportunity for infection, and also less environmentally friendly. And so for those reasons, I do recommend recommend the quick pen, multi-dose pen versus the single-use vials. But some people do prefer the vials, and that's okay as well. Other than Zepbound, there is oral Foundayo, which is the newest FDA-approved obesity management medication. I did a video about that recently, which I'll also link so you can learn more about that option, but you can get a 30-day supply of those pills through LillyDirect. Even though I'm not going to get into the weeds about how to dose the Zepbound quick pens, this is something, of course, talk to your provider, and you can also reference my last video for tips on that, or information again to take to your provider to verify that it is safe for you. But there were a couple of common questions, and I do want to address those here. The first question I got quite a bit with the multi-dose Zepbound pens is, do you have to prime before each dose? And the answer is yes, that is recommended because that helps to get any air bubbles out before you do your injection. And so I'm going to quickly just show here how you prime. So you would take your pen, it's set at 0, the cap would be off, and then you just turn the knob until you get to that first line, the longer line, and then you just press the button. And then as you see, it'll go back to 0, and that's priming. That's all you have to do. And then you would turn the knob if you were taking the full dose. As prescribed, you would turn it all the way to 1, and every dose is going to say 1 here. The first, second, third, and fourth dose, it always will say 1, and then you give yourself the injection, of course, into your skin. But again, reference my other video for more details about how to use this quick pen, but you do want to prime it with each dose. The next question was, if you are using more than 4 doses with your quick pen, how do you get more needles? I will include a link in the description on information about buying additional needles. You can get several dozen for a very inexpensive price, so I will include that below. Another common question was what to do about keeping the pen at refrigeration temperature. So when you get the medication delivered to you, it'll be in packaging that will keep it at refrigeration temperature. And so as long as the medication has stayed cool, then open the box, put it into your refrigerator right away, and keep it there. When you are ready to dose yourself, take the pen out, give yourself your dose, and then put it back in the refrigerator right away. Don't give it time to get to room temperature. At any point, if your pen does get to room temperature, if it arrived and it isn't cool anymore, if it you weren't home and it took a while to get to the package, or if you accidentally left it out too long and it's now at room temperature, keep it there. Putting it back in the refrigerator after it's been at room temperature could make the medication less effective. So once it's at room temperature, keep it there. It may, after about a month of being at room temperature, have less effectiveness. But that being said, that's a hypothetical, theoretical concern, and I would continue to use it as you have been, especially because you're paying out of pocket for this medication, and I don't want you to waste any of your money. You always could call Lilly and see if they are willing or able to give you a replacement. If you had, if the medication was ruined by accidental means, but I would continue to use it. Of course, you can always ask your doctor what they think is best for you. And then there's the 30-day expiration date after you first use the pen. And that's what the manufacturer says. That's what Lilly says. And it's important to know that after that 30 days, the medication does not become dangerous by any means. Again, theoretically, it's less effective. So it's designed to be used within 30 days from the first injection. But I have seen clinically that it continues to be effective beyond that 30-day time frame. So if it is right for you, you may want to use it beyond that 30-day window. What is the cost for LillyDirect? So this program cost depends on what dose you are prescribed. and the cost increases at higher doses. So the initial dose of Zepbound is 2.5 milligrams, and the 2.5 milligram prescription for either the multi-dose quick pen or the single dose vials, so for 4 vials, is $299. For the 5 milligram dose, it's $399. And for 7.5 and higher, so 7.5, 10, 12.5, and 15 milligrams, the cost is $449. And if taken as intended and as prescribed, that is a cost per month. But again, there are ways to make the quick pen potentially last longer and save you some money there. So talk to your doctor about that option for you. If you are deciding to treat your obesity or metabolic condition with Foundayo, the oral GLP-1 medication, then the cost is $149 for the starting dose, $199 for the second dose, and then $299 for all the subsequent doses. And the last thing I want to highlight about the LillyDirect program is that you do have to order your next refill within a 45-day window. So 45 days from the last delivery of your medication. So I typically recommend patients order at least every 6 weeks. Most patients are taking 4 doses with each prescription, but if they are taking more doses than that under my medical guidance, or if you're doing that under the guidance of your physician, then it may be lasting you much longer than that. But you always want to be ordering within that 45-day window. If you don't, they will give a one-time grace period to maintain in the program, but if there's been 2 times that you have ordered outside of that window, then you will have to start paying a higher price. And that is a little bit different based on the Zepbound dose or the Foundayo dose. So I'm not going to get into that, but it can go up to $699. So it's quite a big difference and something to really keep in mind when you're starting and or continuing using LillyDirect. So I hope you found this helpful. I have many patients who use this program and have been very, very happy with the customer service and the ability to get Zepbound specifically for a discounted price. I'll also mention here that if your insurance does cover Zepbound or another GLP-1 and you are going to pick it up at the pharmacy, but there is a very high copay, instead of switching to LillyDirect, it's worth looking in to see if you could use their copay coupon, which could give you a discount for your copay and may make that much more affordable long term. And another thing I do want to mention here is that the money that you spend at LillyDirect is not going towards your deductible. So that's really important to be aware of. Again, especially if your insurance is covering the medication, those copays that you're paying at the pharmacy are going to your pharmaceutical deductible, but the money spent through LillyDirect unfortunately does not go to your deductible. That is a separate program outside of insurance. Are you using LillyDirect? Are you using another method to obtain your GLP-1 medication? What questions do you still have? Please comment below.